Donna. Thank you, everybody, for coming. We want to, it's great to see a good turnout. This is a wonderful room. Thank you, Cindy, for providing it. Hopefully, we'll be down the hall in that Monavie room someday soon. It's kind of interesting that they're here. There's so much interest in health and wellness. It's a multi-billion-dollar industry. And as we see all the issues going on out there in the world, people looking for new purpose, and we want to be healthy, and we don't feel good. So a lot of people are looking for the answers, and a lot of companies are really prospering from that and making awareness, but that's unfortunately not going to do it. And we have a lot of experience actually with that company, so it's funny they're here. But our experience with them was part of our learning process and part of the reason why we created the New Medicine Foundation. Because there's so many groups and there is so much desire out there for health and wellness, but it's not happening. Overall, the epidemics of chronic illness aren't getting better, they're getting worse. We just came out of Breast Cancer Awareness Month, and breast cancer is not getting better, it's getting worse. That's just the reality. I don't like to sound like a pessimist, but from what I see from a medical standpoint, from a healthcare standpoint, I think it's obvious to everybody here, but it's obvious to everybody in the world that the health problems are getting worse. So we need something new. And New Medicine was created, the foundation was created from the fact that over the last over 10 years since I got out of medical school and was looking for the answers, my wife and I both looking together for the answers to health and learning some great pieces of that from the Functional Medicine Institute, which has incredible science, ACAM and A4M, which talk a lot about alternative therapies, a lot about hormonal balancing, but I know are not on the right track. A lot of aggressive hormonal balancing, anti-aging ideas that don't make a lot of sense. And so there's a lot of alternative care going on as well, but there's not the answers that we need to see there either. There's not a lot of science behind it. There's not a lot of efficacy, not a lot of real treatment success. So several years ago, as we started putting more and more pieces of the puzzle together, learning how to appropriately balance hormones, how to appropriately apply that functional medicine science and figure out what's going wrong with everybody, learn how to truly detoxify the body, because that is the primary problem. We're all becoming more and more toxic. We started putting these pieces together and started to see the incredible results that we wanted to see for ourselves, for our patients. And since we solved that problem years ago, then really the word started spreading across the country that people were looking for this, that we could deliver it virtually, and that it worked. The results were incredible. The science behind it is incredible. So the foundation really travels right down the middle of the pseudoscience in traditional medicine. The traditional medicine and the pharmaceutical industry really claims to be incredibly scientific. And they do a lot of scientific studies, but unfortunately most of it is biased. Most of it is really not truthful, unfortunately. And then there's this huge alternative or complementary healthcare movement, this natural healthcare movement that doesn't have a lot of science. And we need to. We can't all go get chelation several times a week or do all of the random kinds of detoxification out there. There is a way to blend that and have natural healthcare, lots of science to support it, and a lot of results, so this works. When we apply new medicine, almost every health condition that exists will start to go away. The body wants to heal. The body does not want to be unhealthy. So as Donna said, we just want to get people as healthy as we can. We want to get this new medical care to the millions, 1 billion, I think, in the world that need it. Monavie's, reaching in the billions. Well, we need to get this kind of care to people, and we think we can because it can be done virtually. It's incredibly scientific, so the science is really black and white. It's very beautiful to see how we do what we do, and it works. It works quickly. So we'll get into some of the slides to support that. Tonight, I'll talk a bit more about new medicine and how it came to be. Luckily, I forgot my power cord, so I've got 33% on the machine here, and I think it'll last us if I can do it smoothly. And I'll just use some of my visuals here to explain what we do. There's a couple key parts to what new medicine is. We want this to be the new standard. This is what the foundational health that we provide is what we think should be done first and foremost in everybody. Whether it's preventative care and someone thinks they're healthy and they want to make sure, we're going to do our thorough scientific testing to make sure we know what's going on biochemically and see if there's something developing. We can see diabetes developing. We can see heart disease developing. We can see autoimmune problems, even inflammatory problems. We can see all this coming. So this should be done first and foremost in anybody who wants to be healthy. This is what primary care should be. You should get thorough testing that's not based on finding out what condition you have, what insurance code you need to be given, what diagnosis you need to be given, or what medication you need. We test. We're not biased as to what we're looking for. We're looking for what is the state of health in your body. What is the biochemical state? If you already have illness, we want to find out why that's there. We want to work with as many health providers as we can. We have a couple of different groups. The foundation is the scientific entity. We also work with chiropractors, naturopaths, dietitians, because we can all practice this kind of science and get this care to as many people as we can. We also have a network of health counselors that Donna is really leading the way with, because counseling and education is such a huge part of this. So we want to work together with as many physicians as we can, as many of the health educators out there, of the people that want to be in the health profession, like the people in Montevideo or all of the people trying to get into the health fields today, to get this care to people, because it's very simple to do once you understand what needs to be done. We need to get some thorough biochemical testing. We need to figure out what's going on, which is very simple. And we need to provide the answers and solutions to the people to help them get where they need to go, which is basically efficient systems to detoxify the body, provide the appropriate biochemical balance quickly, and get people feeling better quickly, and taper off and get rid of those medications that were all so heavily prescribed, and get us feeling better quickly and see results, which doesn't always happen with a lot of the natural care out there. Talked a bit about why we're doing what we're doing. Haven't seen a lot of the answers out there with the other groups. A lot of anti-aging. We were at a great conference this weekend with Hay House. And again, such interest in mind-body medicine, mind-body therapy, which is wonderful. And we need that. But unfortunately, that's not enough to keep us healthy either. We need to be biochemically balanced. We need to be hormonally balanced and nutritionally balanced to be able to be as healthy as we need to be. And mind-body is wonderful, but a lot of people these days are having trouble even being balanced mind-body, because we are so biochemically imbalanced, it's hard to even think straight. There are very powerful imbalances inside of us that have to be straightened out and can be done so quickly. And we see a lot of tenets out there in the natural world that aren't correct. So anti-aging isn't really what we need to be thinking about. We need to be thinking about healthy aging. We don't want to have hormonal balance. We don't want to balance an 80-year-old at the level of a 20-year-old. That doesn't make sense. That's actually going to age us more quickly, and that's a lot of what's being done. So hormonal balancing needs to be done correctly. Detoxification needs to be done correctly. And what we see is that a lot of it is not being done like that out there. So we've put all these pieces together that work so well, and felt that we needed to do something on our own called New Medicine. The basis of it is these key three things that we think are at the root of all of the illness we see today. Primarily, it's toxicity. And a lot of people here will talk about our detoxification program, and we'll get into that a little bit. That is key. We are being flooded with more toxins in the last 100 years since the industrial age, but more so in the last couple decades, since we've allowed it to go into our foods and we've become so reliant on medications for health. We go to our physicians now, and the answer to every symptom is medication or surgery or something unnatural. That actually makes us more toxic, it makes us more imbalanced, and in ignoring the true problem and lack of education as to what's really going on, the education and the need to correct our biochemistry, we simply get worse. We get on this downward spiral of health, and now at younger and younger ages. So we're at this tipping point now where we're all getting sicker and sicker. 98% of us are getting ill, which doesn't make any sense. We're being told it's our genetics, that we need more medications, that we need more surgeries, that obesity, diabetes, heart disease, some of the things they'll touch on tonight, hormone imbalances and depression are just a fact of life, and they're just getting worse because we're living longer. It doesn't make any sense because they're epidemic, and they're now being seen in our children. And our children, we're so toxic and so imbalanced that we're seeing these chronic illnesses in our kids, and that's unacceptable. So we have to detoxify, and that was the last piece of the puzzle that allowed us to get people well quickly, but it's a very powerful piece of the puzzle. It has to be done. It has to be done naturally and effectively, and we've really perfected how we do that with a system that works very well, very quickly. It's fun to do, and has incredible results. really secondarily, hormonal imbalance is becoming a huge problem. That's a huge part of our biochemistry. Hormones are very important in controlling our bodies, and they're epidemically imbalanced. We have super high insulin causing diabetes, super high leptin causing weight gain and hunger as we get heavier, very, very high levels of estrogen. So we should not be taking estrogens. That's one of the big misconceptions out there. Very few women need estrogen. And we have tremendous deficiencies, and now our children are deficient at birth. Our testosterone and progesterone levels, our thyroid, our adrenals, and often all the way to our growth hormone levels are deficient. Sometimes they need to be replaced accurately at the appropriate level, bioidentically, of course. We should not be using synthetic cancer-causing hormones, which is what we've been relying on for years. And some need to be replaced immediately. Some might be restored naturally. And there's a skill to knowing which ones need to be replaced at which time. So we have to balance our hormonal chemistry. Why is it so imbalanced? Again, primarily the toxicity. Some of the toxins are hormones. Of course, our diets are a mess. So the foods we're eating create a lot of this high insulin. The medications we're taking, a lot of them are hormones. Every woman from young to old seems to have a reason to be on synthetic cancer-causing hormones. It doesn't make any sense. We do need some hormonal balancing, but it needs to be appropriate. So we have to get away from all the toxic hormones, and the toxins themselves are causing our glands to shut down. So we're seeing these deficiencies at birth now. Babies are coming out of toxic moms with toxic births that are mostly cesarean sections and epidurals and heavily medicated, and babies start getting vaccinated and all these medications right from day one, and that shuts our body's ability to make these hormones off. So it's incredible. We simply find the scientific proof to this and correct it. And of course, nutrition is important. It needs to be something that's doable and fun. You can't just tell somebody, eat organic food, start working out, get off your medications. It doesn't work. We need to be detoxified and balanced and learn nutrition along the way. So that's what we do, and the results really speak for themselves. And this is in direct contrast, again, to the traditional methods where more medication, more toxicity, no education. If there's any hormonal work done at all from traditional doctors, it's with synthetic hormones, usually the wrong hormones, the wrong doses. So they're just really heading in the wrong direction, and there's no nutritional education really at all. Even in the alternative world, even clinics that seem to be doing some of the right things, they don't focus enough on the need for organic foods, which just means real foods without toxins, without chemicals, the need to get away from all of the toxins in our life, in our household, in our makeups, in all of our products. We're just too many chemicals, and it's killing us. So it's not our genes that are at fault, and that's where we're going to head next, is gene therapy and a genetic reason for every disease. One of the talks at the Hay House seminar was a new gene diet, and we really don't like what we see with this, because the idea was our genes are at fault and will turn on to create illness unless we do these drastic things. But no, our genes know what to do. Our genes have been about the same for 50,000 years. What's changed in the last 50 to 100 years is our environment. And increasingly, with our food supply, our medications, just our lifestyle. And it may sound hard to live a more natural, organic life, but it's not. And the systems that we give people allow them to learn that and experience it within weeks. And the body really does the rest. So detoxifying hormones and nutrition, we talk a lot about, we're always looking at inflammation and oxidation, infections and nutrition. Typically, if we take care of the top three there, a lot of functional doctors talk about 7 principles of illness. We're always looking at these 2, but we found that these 3, if you simply detoxify, get your hormones balanced, and get your nutrition balanced, and get educated on what we need to be doing to our bodies, the rest seem to take care of themselves. Infections go away, cancer rates come down. If we want to talk about truly preventing cancer, this is how you do it. Inflammation, of course, comes down. So we've tried to simplify it and make it as simple as we can. I'm going to jump out for 1 second and jump forward to some slides to get into hormones a little bit more. And we'll talk about the detoxification program we use that Donna's very familiar with and was looking for years to find someone who had found the program that she believed so much in, but was doing it correctly. So before we talk about hormones a little bit and its effects, to touch on the detoxification program, it is the HCG program. I was extremely skeptical of it when we found it. I had been hearing about the need for detoxification for years, but I hadn't been convinced that there was a good program out there, something that people would follow. I saw a lot about fastings and raw food diets and elimination diets, and nothing that seemed to be really something I would want to follow that most people would want to follow. I don't think fasting is a good idea. You starve your body. You can have toxic crises from that. I don't believe in selective food diets. I want to eat a broad spectrum diet. I want to eat lots of fruit, lots of vegetables, lots of meat. I want to eat a lot of, we're here to enjoy a lot of the fruits of the earth. So it doesn't make sense to remove food groups. But I knew that we needed to detoxify people. We were doing hormonal balancing. We were doing functional medicine, nutrition, and just not seeing a lot of results. Well, the HCG program, of course, got hot the last decade, as it was in the 70s. It's been around for 50 or 60 years. I was very skeptical. My wife was interested, as she is usually finding a lot of answers, and said we need to take a look at it. So we did, in a nutshell, we discovered the power behind it, the fact that every clinic, I should say, in this country is doing it incorrectly, with the wrong system, the wrong product, the wrong education, the wrong delivery, the wrong everything, the wrong support. So we simply studied it, perfected it, made sure we prepared it correctly, learned how to do it, did it ourselves, started applying it to our patients, and started to see these incredible results, not just physically, that yes, you lose weight, and yes, people are happy, but as a physician that knew functional biochemistry in detail, that knew hormones, that knew what we needed to do with our patients, we saw just a tremendous and efficient, just incredibly fast results with the biochemical things I needed to see. Blood pressure dropping, cholesterol dropping, insulin, estrogen, leptin, all of these hormones that I'll explain in a minute are too high, came down in a matter of weeks. And along with that, people literally transformed, and we sometimes call it the transformation program. You literally transform when you detoxify appropriately. And we know the toxins are actually coming out. There's a lot of different ways you see them come out that we don't have to talk about graphically, but you'll see a lot of great stuff come out of your system. And I see it come out as a physician. I see the cholesterol drop. I see the inflammation drop, all the things I want to see correct. So the detoxification is a huge part of what we do now, because it sets that foundation for balance, and it also provides incredible results. It's easy to do. You feel good when you do it. You are feeding your body with broad spectrum foods. It is reduced calorie, but it's easy to do, and people learn how amazing it is to do. We've put it in a nice package. The HCG protein that mobilizes fat should be done daily, or it loses potency. It should be prescription strength. It should not be liquid sublingual homeopathic. People get results, but it really is not what it should be. And it should be done this way. It should be medically supervised. It should be done with hormonal balancing and a lot of good testing, because even with a high-quality program, you can become more deficient. You will become more deficient in certain things if you only detoxify and you're not doing it correctly. So it really should be medically guided. I feel strongly that it should be as it is. We have a really pretty kit here that we've had some fun developing. And yes, they're needles, but they're tiny. They're like a bee sting. But that program is really what needs to be done. It's incredibly professional. We've really put a lot of our heart and soul into it to make it work, and we're proud of it. It needs to be the standard. When people talk about detoxification, if they talk about HCG, if they talk about weight loss, this is how you should do it. Weight loss is a side effect, but this is how you should do it. Safely, medically guided, with a lot of good science to back it up, so that you're not doing this. And we see this. I saw this actually last week. Patients coming in, opening up a brown baggie, showing me something they got off the internet for $40. Pretty scary. That's not how healthcare should be delivered. So the detoxification is a crucial part, and we'll not go into that in too much detail, but to talk a little bit more tonight about what a key role hormones play, and also in some of the psychiatric, the mental issues going on. touching on the hormonal imbalance, we're simply imbalanced. Talk about women's health these days and difficult menopauses or difficult cycles every month, difficulty with pregnancy, fibroids. Estrogen's too high, progesterone's too low. This is somewhat of a misconception out there. We've been told that estrogen is too low for years and every woman needs estrogen. It's too high. It's not only too high in women, it's too high in men and children as well. The toxins, the medications, the hormones in the food, in the cattle, the livestock. There's a lot of xenoestrogens that act like chemicals like plastics and BPA, phthalates that act like estrogen. Genetically modified soy acts like estrogen. So we're just estrogen dominant through the roof, and estrogen grows tissue. Estrogen is cancerous. Estrogen makes us big and swollen and fat. It makes us inflamed. It makes us edgy. It does a lot of things in excess that we don't want. So the last thing we should do is put more into our body. And the first thing that most hormonal physicians do is give a woman estrogen. And so over the years of women coming to me saying, I'm on bioidentical hormones, but I just still don't feel good. I've got to take more and more. I'm still having hot flashes. By the way, I'm 40, 50 pounds overweight. It just took some research from us treating to see that these estrogen levels were just off the charts. And what we really needed to do was get them off the estrogen. Figured out it's not just women, it's men and children alike. Also figured out how to get them off that synthetic estrogen. It's extremely addictive. You become estrogen resistant and you need it. So the detoxification helped us do that quickly. So this has got to come out. The hormones that we talked about that are deficient, they start right here. Testosterone and progesterone. Testosterone in men, progesterone in women. Our bodies are shut down. Our gonads, our ovaries and testes are shut down by chemicals in our environment as well. Atrazine is a well-known one. It's a widely used fertilizer chemical, and it simply shuts down our body's ability to do this. Narcotics, medication. I haven't done the research yet, but I sense from what I've seen that psychiatric medications, typically anything really addictive, seems to just make this much worse. Patients who come to me who have been on more and more medications have more severe deficiencies. We've got to replace this. Unfortunately, the body's too far gone, and we need to get this replaced. It's very easy, it's bioidentical, and it makes a tremendous difference in how we feel quickly, within days. It's inexpensive. It's typically about $50 a month. So there's no reason that everybody shouldn't get these hormones checked. We use a saliva test. It's very accurate. It's very easy. It shows us the most accurate levels of where these hormones are. Talk about mental problems, the epidemics of psychiatric, depression, anxiety, fatigue, irritability, relationship issues, world peace, global tension, everything, road rage. It's right here. This is where it starts, our imbalanced hormones. We don't feel good. We're edgy. These are relaxing. These are stimulating. This has to be fixed. You have to detoxify the estrogen out. You have to learn where it's coming from, get off the medications, get off the non-organic foods, and you need to get this replaced accurately. This isn't anti-aging. It's not going to reverse your aging, but it's going to slow it down, and it can have this incredible look that it looks anti-aging, but it looks natural. It doesn't look anything like what anti-aging can look like. So this is just a huge part of health, and the detoxification helped us. We knew where we were going with this hormonal balancing, and the detoxification helped us get there. We're going to talk a bit about cardiovascular disease tonight. It's epidemic. 85% of us are developing it. Makes no sense. Why would all of our bodies be wanting to kill ourselves? It doesn't make any sense that our bodies would want to do this, that we would want to start degenerating so early. We're designed to make it to about 120 years old. And we know this because in non-modernized nations, that's common. And the people look incredible. They look young up to 90 to 100 years old, and then they just simply have a quick decline. But what's happening is our bodies are completely imbalanced. We're toxic, we're hormonally imbalanced, and we're nutritionally deficient. And so what's happening is we're developing all of these degenerative illnesses in all of our organ systems. It's all degenerative. It's all multifactorial. It's a combination of toxicities and hormonal imbalances and nutritional problems that result in the other aspects of care of health I told you about: inflammation, oxidation, infection, of course, more infection that we're prone to. But 85% of us are developing heart disease, now in children. This is part of that. Heart disease is not high cholesterol blocking arteries that we need cholesterol medications for. Heart disease is sick arteries, arteries that are degenerating, So whether it's heart disease, heart attacks, strokes, peripheral vascular problems, it's all a cardiovascular system. Arteries, our pipes are corroding. Our pipes are rusting, and they're plaquing. They're building up gunk, just like pipes in a house do, because they're not healthy. And you know, pipes in a house, they don't just build up something that's flowing through the pipe. The pipe is actually degenerating from the inside out. That's what's happening to our arteries. So yes, cholesterol sticks to this corrosion, but so do white blood cells, so do platelets, and you can't simply turn off white blood cell production or turn off platelet production. We shouldn't be turning off cholesterol production. It's there for a reason. Why does this inflammation occur in arteries? A number of different reasons. Inflammatory reactions to toxins. Inflammation also because this causes inflammation and this actually reduces inflammation. Not to mention, we'll talk a bit about adrenals, but our adrenals are deficient, and cortisol reduces inflammation, and it's too low in all of us. Vitamin D3 is deficient. That regulates our immune system. That's a key nutrient that we check. It's actually a hormone. Incredibly important. So that causes inflammation. Not to mention other key nutrients like vitamin Bs that are deficient, that cause high homocysteine levels, that are a sign of more inflammation. So the reason we're all getting heart disease isn't because we're genetically designed to get heart disease. There's not a gene for heart disease that we have to turn off, and we better not go messing with that. We better not do gene therapy to try to start turning off genes. Then we're going to really create some unintended consequences that might be scary. It's a multifactorial approach. Get the toxins out, balance the hormones, and find out what's going on nutritionally and biochemically and fix it. So this whole pyramid, and I'll brush over the rest of it, but it really starts here. Everybody has this, we treat this in everybody, and you feel good quickly, but you're also correcting all of these other problems that cause all of this other illness. Heart disease, as well as autoimmune problems, cancers, you name it. Our bodies are weak and not healthy. The deficiencies in hormones go up this pyramid that kind of represents the body as well. Adrenal glands, our stress gland, our quarterback of our body, they're deficient in most of us. It's just a question of how much. We don't have too much cortisol, as you hear about. We have too little. Cortisol regulates blood sugar. It controls inflammation, so we don't have enough of it. We have inflammation. We have sugar cravings. We have all kinds of crazy stuff that cortisol helps regulate. We use a little bit of cortisol in about half of our patients. It's tremendous. Thyroids are out of balance. We know that. You don't balance them with synthetic drugs. You balance them with bioidentical thyroid. It's cheap. It's easy. It's effective. But, of course, we don't like it in this country because it's not profitable. So it's very simple. It's incredibly effective, and it should be done accurately and optimally. Thyroid can improve a lot when you detoxify and you improve your metabolism and you lose weight. It's gonna correct a lot naturally, so we may watch that one if it's just a little bit suboptimal. If it's a lot suboptimal, also thyroid relates to homocysteine, so we take all that into account as to whether someone needs thyroid, and if you need it, you need it, and it does wonderful things. Pituitary gland and hypothalamus, we look at all these things too on up in the brain. Leptin is a new hormone we're learning about. It's been around a while, but leptin controls your hunger. It's related to your weight. Just as we get insulin resistant and we get diabetes, we get leptin resistant and we get hungrier. You've got to bring it down. We didn't know how to bring it down quickly until we learned how to truly detoxify people and feed their body from their own fat stores while they lose weight and reduce calories. In doing so, they feel good, and leptin can drop from 40 or 50 down to 10 or 20 where it's supposed to be, even lower. That's how people emerge from the entire treatment feeling better. Cortisol's improved. They feel better here, more relaxed, more mentally focused. Their adrenals are working better, less brain fog in the morning, better energy. Their thyroid is improving, whether naturally or replaced. Their metabolism is functioning better. They're keeping their weight off. Their leptin is reduced, so they're not as hungry. They come out feeling completely different biochemically. They're able to eat more normal foods, not be so hungry that it's a whole pizza. They'll be good after a piece or two. It's got to be organic, and we should still minimize starches, but we can have our pizza. Insulin is reduced. So you talk about preventing and correcting diabetes. This is where it starts. You reduce insulin. Vitamin D3, actually a hormone, one of my favorite nutrients to replace. So this all relates into every problem out there as well, from heart disease and the inflammatory problems that come from this, to the psychiatric problems, to the weight gain and diabetes problems. It's all related. And it's not our genetics deciding that we're going to get sick. It's our genetics saying, we don't know what to do. This world looks insane. This food coming in is not food. It's chemicalized and perfect. Gonna probably just have enough power. It's chemicals. It's not nutrients. It's not food as our bodies want to see. Our genes want to see real food. So that our genes don't know what to do. They're confused. And what happens is we get inflamed. We start to look as we look now. We're not looking like what humans are supposed to look like, and we're getting all of these crazy illnesses. Now, chronic illnesses, and this relates to any illness. This relates to cancer. If we want to prevent cancer, we've got to get the cancer-causing chemicals out. We've got to detoxify them. We've got to learn where they're coming from, and we've got to get strong, healthy. We've got to get our D3 replaced. We've got to get our hormones balanced. We've got to eat real food and get any nutritional deficiencies balanced. We're going to test for all these along the way. So we start with blood work. It's thorough, but it's really simple. You simply go to the lab, and we're going to look at a lot of different markers. Typically, we get 4, 5, 6 pages of blood work. This is a saliva test showing us lots of different hormonal levels. This is what healthcare should be. This is what medicine should be. This is what doctors should be doing. Doctors should not be focusing on problems and insurance codes and diagnoses and medications and drugs. Those are there when we need them. Those are there for emergency and life-sustaining care. It's great. When I blew my knee out, I needed reconstruction. That's phenomenal. I wouldn't have wanted to be awake for that, so anesthesia is great. But we shouldn't be handling day-to-day problems and our bodies degenerating in these epidemics of illness with drugs and surgery. We've got to get back to natural science. Science, but nature. And we also can't simply go rely on all of these alternative things that there's truth to. Chelation can help. Wonder products, juices can help if they're healthy. Lots of supplements can help. But simply taking a boatload of supplements is not going to get to the root of the problem. It's not going to get you detoxified. It's not going to teach you what you need to know. And once you do this and get balanced and learn how to give your body what it needs, staying healthy is easy. So this is typically a one-time thing. You get healthy, and we teach you how to stay healthy. Yes, I like people to come back maybe once a year, get some blood work checked. Things can change along the way, but this isn't something you do over and over and over. I'm going to show a few quick testimonials are always fun. This is Lisa. Donna, did you know this is Lisa? Who was talking about her daughter? Oh, no. This is a great example. This is a young woman who works at a great associate of ours, a chiropractor in Kansas City that delivers new medicine with us, which is what our goal is to have all different practitioners help deliver it. They provide all the services they can, and we all work together. Well, she was very unhealthy, didn't want to be, worked at a chiropractor's office, so she's very natural, but hysterectomy at age 30, lots of autoimmune illness issues, lots of GI issues. I think she may have been almost developing Crohn's or ulcerative colitis. This is 3 months. This is common. We simply do exactly what we said we did. We get labs, we know what's going on, we detoxify her, we replace what's needed, and the body does the rest. When you're this is kind of a perfect example because she's young enough that she's ready to heal. We would expect at least 90% improvement, and that's what we got. I think she's just 100%. We won't promise that the body can always get all the way back to perfect health. A lot of us, we're developing these imbalances over years and decades. We typically see about 75% improvement in anybody, even someone who's elderly and has significant problems, has already had maybe a heart bypass or some serious degenerative illnesses. But the body wants to be healthy if it's given the right directions and if we know what to do. This is pretty common. Another great example, someone a little bit more significantly ill, was Tim, also out in the Midwest. This is a fellow who had MS for 15 years, severe MS. And luckily, he wasn't on a lot of medications. We'll deal with medications. It is warm here, isn't it? the lights. We'll monitor and manage medications. They can be removed quickly, by the way. We typically will throw out the ones that we can throw out really initially. Cholesterol meds out the window. Blood pressure meds will be tapered as the body detoxifies. Some other meds like psychiatric meds, antidepressants, we need to be more cautious with, but we'll typically taper and get rid of all of these things. So how awesome is it to be off medication? Luckily, Tim wasn't on any. He'd been there, done that with all of the meds. Charlie, I'm just going to keep going on so it's okay if it runs out. He'd been to Mayo, he'd been to Cleveland, and to talk about the fact that it doesn't matter the big names of these institutions, Shands, they're all doing traditional medicine. It doesn't matter if you get to go to Johns Hopkins. They're doing the same thing. They're doing the same kind of traditional care, the same system, and they're still wrong half the time. Studies have proven they're wrong half the time with what they're even treating. So he'd been there, done that, and was ready to do something different. Again, we don't promise that we're going to cure your MS. We're going to get your body healthy and see what happens. 6 months later, doing the same approach, and he's 75% improved. That's the most important thing, is that his reports and his family's reports are that he can function now. He still has MS. It's not gone. But he feels great. He can tie his shoes. He can play with his kids. He can cook dinner. 3/4 of his functioning came back. And it's not progressing anymore. So these illnesses will at least stop progressing, because we're going to give the body the things it needs to stop developing what's developing. And one last one before I run out of... Exactly. This is Karen, wonderful person who I've known most of my life, actually. This is someone who's pretty healthy and just wants to be healthier. Didn't feel perfect. Actually had some sugar cravings and some energy issues, which to me is adrenal hormone deficiencies. This is 3 weeks. A quick detox, some hormonal balancing, really subtle. A little bit of thyroid, a little bit of progesterone. That's all she needed, just some support for those hormones that were deficient, but not severely deficient. She doesn't look severely ill, but a 10-pound weight loss, restored color, restored vitality, just felt great. So people can be fairly healthy and just want to be healthier, or they can be very ill. This is where everyone should start. This is what every doctor should be doing. And it's tough for me to say this, because a lot of people say, well, you know, why do you all know so much? We're just paying attention to the right things. We're learning the right science. We're applying it. And we're asking questions. We're asking why. Why are these things happening? How do we prove it? How do we fix it? How do we make it easy and fun? You know, it can't be fasting. It can't be 50 supplements. I don't agree with Suzanne Summers' hormone regimen. She's taking a ton of estrogen, and she has a 15-minute cream routine every day. That's not the way it works. You don't need estrogen. We typically have 1 or 2 small pills. They're very affordable, and you take them like you do any other vitamin. So we try to make everything simple, but incredibly scientific. And so we talk a lot about autism, autistic spectrum, hyperactivity, ADHD. These illnesses in children are simply chronic illnesses when your body hasn't had enough time to degenerate in the organ system. So Alzheimer's, heart disease, osteoporosis, all of these things take decades to develop. Our bodies are pretty tough. So kids aren't going to develop those right off the bat. Amazingly, they actually are. Teenagers are actually developing high cholesterol and heart blockages and things like that. But in young children, they have developing neurological systems. They have developing immune systems. And they're being loaded up with the same chemicals, if not more so, with 30 or 35 vaccinations now. That's standard. We don't need these things. So what happens to children that are onslaughted with all this toxic information and all this miscommunication is that these young developing systems go haywire, start to break down. So the things we see in children are exactly just that. Behavioral issues, autoimmune, lots of autoimmune problems, and allergies, and rheumatoid arthritis, and all of these things, psoriasis. These are delicate and growing systems in our bodies that are susceptible at young ages. So that's all we're seeing is chronic illnesses in children. And you have to take the same approach. We don't prescribe hormones to 5-year-olds or detoxify 5-year-olds. We teach the family. That's where my wife, Dr. Jules, has all the fun as Dr. Mom. It's more educational, just teaching the family where all this is coming from. What happens, though, is that as they approach puberty is when things usually kind of get worse or emerge because our bodies are not developing into puberty as they should. That's when the hormonal deficiencies, the hormones should take off, and they don't. Our bodies kind of start to rev up and start trying to start your car, and it just won't start. And that's when kids really start to have significant problems. That's when I will step in and treat them like this. It's still natural, but if children start to have severe functional problems where the parents are thinking about horrible medications, like Ritalin or anything really, antidepressants, hormones in kids, synthetic hormones, they might need a little bit of a bioidentical support, and they need to be detoxified before they start on that downward spiral of healthcare. Medication after medication, it just makes them worse. So we're passionate about getting out there and making this the standard of healthcare before it's too late, before people get more and more unhealthy. Not to mention the economics of it. It's cheap to be healthy. It saves a ton of money. I think it saves it would say two-thirds of really what it costs today to just go to healthcare practitioners or be on medications or go to repetitive doctor's visits and just be unhealthy, not know how to eat right, consume too much of everything, chemicals and foods. It saves a ton of money. So it really pays to get healthy. And we're happy to see the results we get for a pretty low expense. Thanks for listening. Any questions? A little early. Yes?
Yeah, I might keep it simple. So you basically state that like our body deteriorates because of basically what we ingest in ourselves, and it just like what we take in kind of just imbalances all our hormones. Is that basically like what you're saying? Or?
Problem number one is toxic environment and foods. So it's twofold. The foods are toxic. They're full of toxins, and they're also not nutritious.
Which goes for every health.
Pretty much, absolutely, yeah. The word organic is the word to look for. It's not perfect, but it's the best thing out there. Gourmet means nothing these days. Gourmet means expensive. Natural means nothing these days. It means synthetic. Certified organic, you got to do the best you can. Grass-fed, wild, happy animals. Watch Food Incorporated. Share it with your friends. I mean, it's that bad. It's not just about fast food. It's anywhere. It's Ruth Chris. It's Capital Grille. It doesn't matter. If you don't know what you're eating, it doesn't matter what it costs. I'm all for a great piece of steak or buffalo. It's got to be a happy animal that's been raised the way nature intended. So the chemicals are number one. We're getting full of these chemicals. And then the secondary side effect is that the chemicals shut down our body's abilities to make some hormones. And also the foods are not nutritious. So we've got nutritional deficiencies. We've got these hormone deficiencies. We've got these excesses of toxins, some of which are hormones. The foods are too sugary, so the estrogens go up, the insulins go up. We get heavier, the leptin goes up. So it's just this. It is. It's a horrendous imbalance, and then we're treated symptomatically with more meds, no education, and what happens is we get worse. So you get on a blood pressure med, then you need more. You get on an antidepressant, then you need more. You get on a synthetic hormone, and then you need more. We become immune to it, and the problem gets worse. So the blood pressure, the cholesterol, the depression, the weight, the diabetes, everything's going to get worse until you actually get in there and fix what's wrong, which is what we do. Yes?
I haven't touched upon buying organic yet because I'm still too cheap to do it. But what's the general consensus? Is that an honest industry? When it says organic, it's organic?
It's as good as we've got, and it is fairly honest. It is head and shoulders above the rest. What do you think, Donna?
Yeah, I
And the meats and the poultry and all,
Yep.
they
agree. They
say
have
it
a very
is.
stringent set of code that they have to go by. And I think it actually takes an organic farmer or even a animal raiser 5 years to become certified.
Yeah.
So they're actually organic for 5 years before they get the organic certification.
I would trust the green market for sure. There's one in Gardens. It's amazing.
I think Whole Foods is a very good outlet.
It's getting better. This is trendy. It's catching on. For so many reasons. Organic is catching on. The food's delicious. People feel better just eating organic, but there's more to be done, and you need to get there quickly and get off all the addictions that the chemicals and the imbalances are doing. But being organic is trendy. Being green, I mean, the failure of our health is going hand in hand with the trouble in our world, and the climate is most likely impacted. I don't think it's all from our doing, but it's certainly impacted. The economics of it all is failing. Our failing economy, 20% of it's our healthcare system, $2 trillion a year. It's insane, and we're just getting more sick. So organic is worth it, absolutely, without a doubt. We recommend you go through at least a short process of this to get balanced and really reappreciate food, because it's tough to simply switch from whatever you're eating now to whatever you're eating now and make it all organic. It doesn't really work. That's expensive. But when you clear out, when you detoxify, get hormonally balanced, learn to appreciate really what kind of foods you should be eating and want them, which takes biochemical balance. Then you come out and you're eating less, you're appreciating it more, you're enjoying it more, you're eating out less, you're consuming less. I mean, it saves money all over the place. Every patient we have says that treatment pays for itself within the treatment time, because they just shop, eat, live, less medications, less doctor visits, less everything. We start to, and that's kind of the trendy now too, living more economically, not minimalist, but really less consumptive, and this is what it takes to get there.
This New Medicine Foundation, what exactly is it? Is this your practice?
It's our answer to the AMA. So it is my practice. Okay. It is our practice. However, we are bringing in physicians as quickly as we can to learn how to practice new medicine. So everything today is really governed by the AMA, and I think it's completely, incredibly corrupt and wrong. So it's our answer to the AMA. It's what the standard should be.
I agree with everything that you're saying. My daughter, who will be turning 40 in a couple of weeks, had a baby 2 years ago, and she went completely organic, natural. She detoxed. She did the whole detoxification herself. And this baby has never had dairy. He's never had meat. He doesn't know what sugar is. His dessert is a banana, and different fruits. Never once had an earache. Has never been sick. No colds. No nothing. So I'm a believer in natural and organic. We were in Whole Foods last night, and we listened to a chiropractor very, very similar to what we're talking about now. But my question to you is,
I sense a but coming.
yeah, because what exactly are you're talking about coming to you and going for certain tests to see, naturally lab tests, to see what the deficiencies are and so forth. And then
you get tests, you get lab tests, just like you go to a typical doctor, and a typical doctor should get labs of some sort.
Right.
They look at blood counts, basic chemistry, cholesterol. That's about it. Blood counts and chemistry look good until you're pretty sick. So that's, you don't get anemic until you're pretty sick. Cholesterol is getting high on everybody because cholesterol is simply a stress marker. Our livers are stressed. They make LDL cholesterol. They treat your cholesterol. They treat your symptoms. So it's really shady science. We look at 6 pages of labs. We look at hormones through saliva because they're much more accurate. We want to see what the true balance is. So we look at accurate information. We get a readout, and we say, this is where you are. You may feel pretty good. You may have a little bit of this or that your other physicians tell you, but here's what's really going on. Do you want to know how healthy you are truly and correct it before the 98% of illness happens? Because unfortunately, that's what happens, is we get cancer, we get heart disease, we get all these things that are epidemic, and it's going to get worse. We just try to find all the information beforehand. And we give you kind of the recipe to fix that. That's what doctors should do. They should really figure out what the state of their patient's health is and balance it and teach them how to live to keep it balanced and what they need. And teach them how to live the kind of lives we're supposed to live, which is, again, where we're headed. We're all headed back towards, we've got to do something. This isn't working. The lifestyle, the foods, nothing's sustainable.
I think most people know that. We know what we should eat. We should stay away from dairy and meat and all that.
They're getting there. They don't know that. Not as many know that as you think, but they're getting there. But how do we get there? How do we get healthy? And how do we do it quickly? This is how you do it. Quickly, efficiently, and really. I mean, you talk about detoxifying. People talk about detoxifying. If you ask someone, hey, I detoxified, what'd you do? I did a colon cleanse. Okay, that's great. It's important. We are incredibly backed up. But what about all of the cells in your body that are harboring all of these toxins? Because that's the real problem. This is what it takes. It's unfortunate that we all have to do this, but it works, and at least we know how to detoxify.
But what is it that, you say this is what it takes, what is it that it takes?
The detox program I touched on, the Cell Center program,
Oh, okay.
which is the HCG protein that mobilizes fats and releases toxins, that's what we use. Unfortunately, that program is used incorrectly everywhere in the country as a weight loss program, and it's not delivered. It's really ruined. We've perfected it. It's the program that should be used. It is the only one that truly detoxifies you quickly and naturally. So that's what we do. I touched a little bit on it. We have some more information on the website about it. I had a question back here.
No, I was just thinking this lady wanted to know what you mean by detoxifying, and I was going to say, doctor, you're talking about HCG.
Right. It's the program I touched on.
Right.
Of course, eating organically is part of it. Everything we do works together. So restoring balance to the body hormonally, nutritionally is going to help us continue living in a kind of a detoxification mode to try to avoid these things. But initially, you've got to get it cleared out. You just have to. Everybody has to. I do several times a year. You continue to suck this stuff up, you will feel different. You will, unfortunately, living in this world, it's coming out of the floors, the paint. We try to eat perfect almost all the time, but it's going to happen, so you need to detoxify occasionally. But initially, that's very important.
How long does it take to detoxify?
It's depending on what you need. 3 weeks, 6 weeks, sometimes people will need initially 6 weeks and maybe some further. Tim, the gentleman with MS, a lot. You can guesstimate a lot of it by how much toxicity you're storing, which you can describe a little bit by how much extra weight you have. You can describe it that way. You can expect 20 pounds every 3 weeks, so you're pulling off that fat, you're mobilizing that fat. It would be a medical decision as to what you need. 6 weeks initially is recommended for most people because we've been accumulating these things all of our lives. I've done that program several times. It's really easy and fun when you start going. If someone's really lean, Karen didn't need 3 weeks. Very, very quick. And it's over like that, and you feel great. People who are heavier may start with 3 weeks. They feel so good, they always keep going. So it's dependent on the person. A very unhealthy person, 100 pounds overweight, heart attacks, a dozen medications, I'm going to ask for 6 months to a year. But we're going to get there, and that's pretty incredible that over 60 years of getting ill, we can turn it around almost completely in a year. We can lose 100 pounds, we can get off most or all of the medications, we can get the person feeling well. None of this stuff is addressed with the traditional doctors. They're so obsessed with the coding and the drugs and the diagnoses and the insurance system. It's embarrassing what our medical system has become. It's embarrassing that they don't understand the first things about this stuff. And they're looking, but the reason, again, why we're doing this is because there's all this alternative, and they're not really there either, from what I've seen. I've learned a lot from them, but they just haven't put the pieces of the puzzle together. So we're trying to teach and just get this information out there as the standard with as much science as we can, and as many people on board. You had a question? Back to
Curious. It seems like you have a pretty good success rate across the board, 75%. The improvement.
Yes.
I was curious if you had any experience with any patients with neuropathy, whether it be diabetic or kind of like a phantom limb pain. I have a family member who is basically a cash cow for doctors, and the core of it is a chronic pain that she constantly deals with that is derived from nerve damage.
Most things are going to want to improve. Again, there can be, if it's a diabetic neuropathy and the high insulin and sugar levels are killing the nerves, you want to reduce the sugar and insulin levels as much as you can. Nerves grow back slowly, 1 millimeter a month, but a lot of that's going to improve. We see things improve across the board because we're just restoring health to the body. So yes, we've had incredible results with fibromyalgia, pain, extremity pains. I've had neurological tremors improve about 90%. Couldn't remove all of the medications in some of them, but greatly reduced. So absolutely. The body, this restores a healthy foundation biochemically to the body. Typically always stops the progress of the problem. And then we'll see how much the body can reverse and how how much it can heal. Depends how far gone that person is, how damaged the body is. Bones take a long time to heal. We've seen some very quick improvements in bones.
But you do stop the process.
Absolutely. Yes. Yes. Osteoporosis, osteopenia, same concepts. Hormonal imbalances, deficiencies, nutritional deficiencies. It's not a disease of calcium deficiency. We take more calcium than any country in the world. We take more bone drugs than anybody in the world, and it's epidemic. 50% of all women over 50 and 25% of all men have weak bones of some kind. So we'll see quick results. Bones take years to remodel, but we've actually seen as much as 30% in 6 months improvement. You've got to restore the balance. The bones are degenerating because of that. It's not, again, we're not genetically designed to have everybody get this osteoporosis, and we don't all need drugs. And it's not just calcium. There's a lot more. It's actually very, very little calcium. It's D3, progesterone, testosterone in men, of course some weight-bearing exercise, but all the minerals in the bones. So we'll do a mineral supplement, it won't be calcium. It's a bone matrix that we recommend just to make sure the bone's got enough food, but it's more importantly the instructions to the bone that the body's giving it through these hormones. D3 is a hormone, the other hormones we talked about. Stopping the inflammation, because the inflammation's everywhere. Osteoporosis is a very inflammatory problem. All these problems are inflammatory. So.
Detoxification for mercury and stuff like that.
We see it.
Does your program
Yeah.
work with that, or is it elimination?
No, it absolutely pulls it out. We see it typically actually increase and then start decreasing. So yes, mercury is in the cells as well, so it's going to pull all that out. Chelation, if we did our detoxification and got to where we were looking good and then still had some specific issues like that, we test for mercury and lead, and we can test for arsenic. Then we might say some chelation might be appropriate, but it shouldn't be done initially because chelation can pull everything out. So it's very nonspecific, it's very expensive, it's very time-consuming, it's just not very efficient. And we'll also try to use oral chelators first. So we have some oral chelators that we'll add. But we'll see it come out and start reducing through this as well. That's the key. One of the key things about detoxification, we're full of thousands, I think tens of thousands of chemicals. Who knows? I've seen, and you can test for them all. You can go spend boatloads of money and test for, chemicals out the wazoo. But we know we're full of them, and we know we should just take a kind of a all-in-one approach. We know most of them are lipophilic, meaning they're fat soluble. They're in every part of our body, and so we need to just use a system that pulls it all out. That's why we weren't thrilled with any program we'd seen, or I battled with chelation for years. Should we do this? Should we not do this? It doesn't really feel right. It's got a place, but it's not going to handle everything, or even much of anything, to be honest with you. This program is what works. And unfortunately, it's got this huge stigma to it because it's just being abused everywhere and done incorrectly. But this is what it's here for. It's an incredible tool. It's got to be done right. And when it's done right, it's effective and it's easy and it's fun.
Patient comes in with all the medicines they normally take, and you keep them probably on the medicines they're on. And as you see the results of the test and improvement, then you start weaning them from the drugs that the doctor has had them on for years or whenever. We medically manage everything, and it's dependent on the medication. So there's a art form to doing this. Some meds can be thrown out immediately. Some I'll say make sure just take them as needed and take them as little as possible. Antidepressants, any psychiatric med, they're horribly addictive. So we do it carefully. Getting the hormonal balancing done immediately is important. We'll get as soon as they actually collect their saliva sample for the test, I'll start them on what I think they need to try to get them feeling better, because that's what's behind most of the anxiety and the depression and all that. We'll get them hormonally balanced, and then we'll start pulling those meds off slowly. We'll typically taper those by half initially and say wait 3 to 4 weeks. Make sure you don't have any withdrawal, because people can really lose it when they come off those things. They can forget who they are, where they work. It's unbelievable. Those medications are horrible. Psychiatrists should be doing hormonal balancing. They shouldn't be doing these medications. They should just do hormonal balancing. It's a few $100, and it's $50 a month to be on the right hormone, and it would handle 90% of the psychiatric issues for those things. Yes?
Do you take health plans?
No.
No.
No. Insurance dictates what doctors do. And you cannot do what you want to do based on insurance. Now, it will pay for the blood work typically. Typically, any healthcare plan will pay for the blood work, which can be extremely expensive if you don't have health insurance. We have a cash plan that does it for $500 or $600, but the blood work alone, from the lab perspective, is they'll try to charge you thousands, just like traditional healthcare is. It's ridiculous. Pay for that. Medicare provides some discounts for the saliva testing. But as a physician, I can't do what I do and report to an insurance company or even bill an insurance company. I did, and it was a losing battle, and I was warned against that by the mentors that I really looked up to the most years ago, but I did it anyways, and it was a good experience. But it's not a tremendously expensive thing, and it just pays you back 1,000-fold over the course of your life. So, yes?
What is chelation?
Chelation is anything that binds a mineral or a metal and pulls it out of your body. It can be done orally, it can be done intravenously. When we're talking about it, most people are talking about intravenous. So you go into a physician's office, you get hooked up to an IV, and they run a solution through you, typically EDTA, or some other solution that is relatively safe, but flows through your body and grabs things that supposedly should not be there, like mercury or lead or excessive calcium on plaques. So it's been used for years to say that it'll reduce plaques and detoxify at least heavy metals, and it can work. It can also pull out a lot of stuff that you don't want it to pull out. It's very tedious. It's more expensive to get chelation than it is to do any of our programs. You sit in a physician's office typically for an hour or two for 20 or 30 weeks sometimes. So it's a tool that should not be used initially. It's in our toolkit if we need it, but we don't need it very often.
So are your physicians all board certified?
I'm board certified in holistic and integrative medicine.
Oh, okay.
We have chiropractors that deliver this. We are talking with dietitians that can deliver some of this care. If it's a health practitioner that can order labs, run labs, evaluate labs, they can learn how to do some or all of this. So,
You really want to
sorry?
So you really want to
Absolutely, it's got to be, because it's nothing's changing. Things are getting worse. Again, at this wonderful seminar this last weekend, wonderful energy, very unhealthy people. Maybe definitely more in tune spiritually, and that's wonderful. But physically, they still need this. Everybody needs this. So we're all looking for answers, but it's got to get out there. So cardiothoracic surgeons, neurosurgeons, they are all at the same seminars I've been at all my life. But again, I didn't see enough answers. Cardiac surgeons are starting to ask, why am I doing so many of these procedures? Why is this happening? Why is every man getting prostate problems and cancer? It's estrogen and testosterone imbalance, among other things. More physicians are asking why. So it doesn't really matter your background. If you're a physician, if you're in the health field, you should learn how to do this. This is the answer to the foundational problems of health. And then people will have things left over. This doesn't fix everything. It's not a cure-all, but it does set the foundation that needs to be set to at least try to be healthy. Yes?
Yeah, I have another question. Real quick, do you suggest or recommend people, as they're doing this program, to exercise, and why?
Exercise is incredibly important, of course. Unfortunately, because of these problems, diet and exercise won't do everything. So yes, exercise. My belief with exercise is it should be fun, and you shouldn't overdo it. So we tell people, just do something, get moving. Somehow, some way. If you haven't exercised, take it very slow. If you're an incredibly tense athlete, maybe take it down a little bit. I wouldn't run a marathon or do the Ironman while you're doing this program, but you can train quite a bit if you want to. And you can do anything you want. Pilates, yoga, some people can get their blood flowing with meditation. Shooting, punching, the gym. I walk. I do some kind of aerobic every morning. I do some resistance training a couple times a week. I try to mix it up. I try to have fun. Just get moving and do something that my body enjoys. So that's what exercise should be. It's amazing how you have energy. As you're detoxifying and you're mobilizing, the fats, you're mobilizing about 2,000 calories a day. You wouldn't do too much. You're pretty lean, but most people have plenty of fat to mobilize, and that's what keeps you feeling good. You're mobilizing energy, so you're feeling good. If you have any excess fat to lose, you're going to feel fine because you're mobilizing that fat as energy. So you feel pretty good. Acupuncture is wonderful. My wife's a chiropractor, and she does acupuncture. And a part of health that I don't do is structural, neurological, and electrical. It's tremendous. It all works together. That is a unique area of health that can have wonderful effects and should be done, along with the biochemical work that I focus on. And I have a pyramid I show that mind, body, spiritual is a huge part of health as well. I think it's very hard for most people to get up there to that level of balance when they're so imbalanced with all of these other things. So electrical and structural balance, we know this works. Unfortunately, there's not the science to it that we think of when we think of science these days, but it's been around for thousands of years. And I've seen it for 13 years. Right.
That wasn't fast enough. That number didn't come out fast enough.
Oh, well, it seems much longer. It's great.
Well, I'd like
Okay,
to
thanks.
thank everybody for coming. If you have any other questions, my cards are on the back table. Feel free to call us. I left some sheets on your chair. If you can fill them out for us, we would appreciate it. And our mission is to spread the word about new medicine and to help everybody healthy alive. I'd like to thank you all for coming.
Thanks for listening.